the thing I have to say first is that the patient have to take a lot of pills every day. The main treatment is called Systemine. So fortunately, this exists because it really saved the life of a patient, and now they can live until adulthood. Before they were dying much earlier. So this treatment allows the exit of cystine out of the lysosome. So it's not, but so it's a good thing. It's there, but it's not without a side effect. So they have severe side effect, and it only slow the progression of the disease. So eventually, the patient still die from the disease. And so the patient have to take between 40 to 60 pills a day because of the Systemine, but also all the chronic disease that they have to face. So there is still a pressing need of finding a new treatment. And so I always believed in gene therapy for this kind of very profound genetic disorder. And but the issue with cystinosis was that the gene, because it's expressed in every single tissue, we had to find a way to provide the healthy gene to all the organs, and that we can just not inject a virus or a gene in every organ. So we decided to use the bone marrow stem cells, and more specifically the hematopoietic stem cells. So our approach is because we don't also allogenic stem cell transplantation. So taking someone else's stem cell is have a lot of morbidity or mortality associated with it. So we are using the autologous hematopoietic stem cell transplantation, meaning that we are using the patient's own stem cells, and we ex vivo gene modify them. So for that, we are using a lentivirus vector that contains a normal version of the CTNS cDNA. And we gene correct them ex vivo. And then after a myeloablation of a patient using busulfan, we infuse them back to the patient. So then the new stem cells that are gene corrected are repopulating the bone marrow of a patient and will reside there for the rest of the life of a patient. And then they will be mobilized in the blood and travel to all the tissues that have tissue injury, so pretty much all of them, and the hematopoietic stem cells become macrophage into the tissue, and they can provide the healthy protein to the adjacent stem cells, adjacent tissue cells, sorry. So our clinical trial is a phase 1/2. So meaning we want to show safety, but also efficacy. So we have multiple endpoints to show clinical outcome, but also one of the most important criteria is the decrease of cystine crystals in the tissue. As I said, this is the characteristic of a disease. So we are supposed to, we will enroll 6 patients, and so far we have infused 3 patients with our cells product. So the first patient was transplanted in October 2019, so over a year ago. And our third patient has been transplanted most recently, like 3 months ago. And so far, the patient we have the most data from are the patient 1, obviously, the one. And we recently did his 1-year follow-up visit, and we could see in his case that we have a substantial decrease of the cystine crystals in the cornea, in the skin, and in the rectal biopsies that we also are doing. And we have seen that with a biopsy, but also we have seen that using a confocal microscope that can that allow to visualize and quantify the cystine crystals. So I have to say that the patient has been out of Systemine treatment since the infusion of the cell product, and also out of the Systemine eye drop. So despite the fact that he's out of treatment, we see a decrease of the cystine crystals that he accumulated while he was in Systemine treatment. So, so far, the results are pretty good. His clinical condition are stable, and he's feeling good. His quality of life improved. And so the 3 patients are still, so all of them have been out of Systemine and Systemine eye drops since infusion. And we're looking forward to be able to see the data in the other also patients when they come back to UCSD for their follow-up visit.